Hey, welcome to the show. I'm here with Brian. He's a patient of ours. He's had multiple transplants, and recently, a few years ago, we had a scare of alopecia areata, which is an autoimmune disorder that attacks the hair follicle. We were concerned because usually there isn't a way of treating this skin condition. So we resorted towards adipose stem cells, PRP, platelet-rich plasma to treat his condition, and we started noticing results in 6 months' time, and we're here to tell you about it. So, thank you for coming, Brian.
You're welcome.
What were the signs that was starting to go? What did you start seeing back in February?
I would wake up in the morning, and I always do this, and it just felt so thin, and then I'd look in the mirror, and I just saw that it was starting to not be there. But I couldn't find any hair on my pillowcase or the sink. It's like it just... And then it accelerated. I think that's when I first called you. It's like, my hair is falling out. I think I just came in, I can't remember, did I come in August and then we made an appointment? Yeah, that was it.
Yeah, I think we had like a 2-week turnaround. We're like, all right, we need to expedite this immediately.
Yeah.
Because it was crisis mode,
yeah.
You know?
That was my birthday, and I remember that was a good birthday present.
Took some time.
Wow. But the amazing thing is, because I took pictures too, where the hair was really solid in the front, and I woke up and all I had was this tiny little hairline, and then suddenly a big round spot. It's like, that wasn't even touched. How could that just disappear?
Right.
Because usually, everything I read, it would happen on the sides.
That's true. But we transplanted here years ago.
Yeah,
years ago. I mean, that was like a decade.
10 years ago.
And it was kind of alarming. And then we started looking at your skin type. It was really smooth. There wasn't really signs of pores. So we knew it was an autoimmune disorder.
Yeah. So it started to go out in December of 2023, and I had come in November of 2023 just to get a little splash here. And that was fine until Christmas. And then that's when it started to show some weird signs.
I think we were like 9-10 months post-op. I guess you started, was it here too, or just up top where it was transplanted?
Up top it started to get thin, and then just one night I'd wake up in the morning and the stuff wasn't thick, and then it was starting to be gone. That's when I came in.
So we decided, let's see if we can't reverse this. So we did some stuff we'd never done before, right? We knew it was inflammatory. It was inflammation that was attacking your hair follicle. And PRP, we know, is anti-inflammatory, and so is adipose stem cells. And I think of adipose stem cells the way we're putting up a shield wall, ultimately. So I know you went through that operation. How'd it feel?
When he drew the fat?
When you drew the fat.
He took it out of the back. It was hard. It was painful.
Feel like an alien was crawling around inside you?
Yeah, I felt you for a few weeks. It was bruised. But I think your dad would have done the front, but that's when he discovered there might have been a hernia, and he didn't want to get close to that. And then I got that fixed. He was right.
Yeah, well, I was glad we made that diagnosis, right?
Yeah, good call, because the doctor said, yeah, you could have done some damage if you got too close to it. So, yeah. But the back worked.
Yeah. Love handles. Love handles. Any issues with scarring? Anyone pointed out to you? What's that?
No, it was just bruised and little holes, but other than that, it was fine.
Okay.
Yeah. You could feel it a little more than taking out the blood.
Yeah. Yeah, that's true. We combined it. We did multiple things. We're trying to simulate this as fast as possible. So we waited 2 months and then reevaluated in October. And did you see anything in 2 months' time? Was there any new growth early on?
Yeah, I think so. When I look at the pictures, you could see that the white was coming back, just tiny little particles. But
Yeah.
as opposed to being bald, which originally in August it was truly bald.
Yeah, there was nothing you touched. So like, where'd the hair go?
Yeah, and I think, and you can see that. I think we were so excited that you could see on that whole bald spot that you had equal size. Yeah, right there. You had equal size white hairs. So we knew we were onto something. And then your dad hit it again.
Yes, let's do another round of CRP.
Yeah.
Just reactivate it a little faster, hopefully.
Yeah, there you go. So you can see the little white hairs starting to come in, because when I came in the beginning of August, it was clearly bald.
Yeah, and we tried again. We did a reevaluation in November.
Right.
Is that November?
That's November, she says, yeah. So
Yeah.
we could clearly see that it was working.
Yeah, that's huge right there,
Yeah.
from nothing to something.
Yeah, and I thought it was phenomenal because everything I've read, they said it could take months and months and months, and then adding up the months, it truly was September, October. So 2.5 months, you could see tremendous progress.
Were you doing any home remedies at the same time?
Yeah, I was doing red light therapy, which everybody said helps, and then I was doing different oils to stimulate it, and then the minoxidil, and then you guys gave me the oil.
Were you doing topical minoxidil? Or?
Yeah, topical.
Okay.
And then when you put on the different oils like rosemary and pumpkin, you could really feel that it's stimulating something up there. Woo-hoo. But
Yeah, peppermint in it.
yeah.
Okay, that's what did it. The
Yeah.
peppermint's what gives you a little bit of a tingle.
Yeah. So I think all that helped, but none of that could have accelerated as fast.
Oh
as,
no, those are. I'm
Yeah.
sure they help, but nothing. They'll never do something like that.
Yeah.
Of that nature.
And that's what I was saying, because everything you read, they say it could take months, take a year, but this really happened fast for so much loss, because it was the same on each side, and then the back, and then of course the front. It's like, how is all of this happening at one time?
Mm-hmm.
So I was very pleased. Oh, I was so pleased. I came back in February to.
Is this February?
That's February.
Wow. Yeah. Look at you.
Wow. Yeah, you're not kidding.
That's what, 6 months.
Yeah.
6 months in, and it looked like nothing happened on the sides.
Golly, I didn't realize that.
Wow.
So you guys take better pictures than I could. Yeah. So then you took from the beard and put it back
Yeah.
up top.
Then I think we made this. We evaluated in January. I think, was it not? It might have been a little bit sooner, but I know the crown was bothering you.
Yeah.
It wasn't that we had alopecia areata in the crown; it's just it was starting to thin out, and we wanted to make sure it was safe to transplant without activating the disease in a different location.
Yep.
So we did 300 beard grafts in the crown, and they've grown in. You can definitely see the difference in the characteristics. They're a little
Yeah.
bit more wavy.
Yeah. Of course.
The stem cells definitely cut down on the disease from reactivating. But that was a scare.
That's the only thing. I never get sick and I'm real healthy. But it's just weird that something hit it so fast.
How's your health been since then?
My health's always good. Yeah. Everything's. So between the outside and the inside, I'm super healthy. That's why I was shocked that it just hit me so hard.
What does your diet consist of?
Eat lots of fruits, veggies, beans, whole grains. Stay away from the added sugar. I cut the added sugar out too after this happened.
Oh yeah.
I read all those labels. Cut that stuff out.
You ever played around with allulose?
No, what's allulose?
Oh man, this is
Allulose?
Yeah, it's a sugar. It's not a real. You know how to explain allulose? It's like a really safe sugar to eat, or it's not even sugar actually, but it's sweet.
What's it called?
It's a substitute. Allulose is a naturally occurring sugar from a small amount of food like figs, wheat, and maple syrup. But it's really safe. It's really safe. Okay. It's not like sugar cane.
So I've been getting. It was date sugar that I bought, and then I used the maple syrup too. But just trying to cut down on any kind of processed sugar. And I think all that helps too.
Definitely.
Yeah.
You just need to add twice as much to get you the same sweetness, right?
Yeah. That's true. But trying to eat healthy, but clearly whatever you guys did accelerated the healing process. That was amazing.
Yeah, we were also talking about JAK inhibitors, but it's almost impossible to get prescribed those.
It's very expensive.
Yeah, what was it, like $10,000 or something ridiculous?
Yeah.
It's nuts.
Yeah. But I mean, I talked to dermatologists and stuff, and they could do the PRP, but they had never suggested the CRP.
Well, it's kits. It's the quality of the kit to make it, and then what everyone does with PRP is they add something to the blood to promote the growth factors. That's called calcium glycosinate, just for reference. And what does that do? It tells the platelets, hey, release these growth factors. The problem is the larger ones can't penetrate through that cell wall. So we just devised a protocol where we burst them. So it's 6 to 8 times more concentrated, plus you get them all out. So it's no longer platelet-rich plasma. It's those growth factors are called cytokines, so we call them cytokine rich plasma.
Hadn't heard of that.
Yep.
And that's what you did to me?
Yep. We did 3 sessions of CRP, spaced out over a 3-month time. It might have been a little bit aggressive, but we didn't want to play games with it, right?
Yeah. You stopped it for sure.
Yeah.
Well, anyone that I see has the issue, I recommend you guys, because it fixed it. It's a nightmare to just lose clumps of hair. But the weird thing is I never saw it on my pillow, and I never saw it in the sink. How could it just disappear?
I don't know.
Weird.
I don't know. It's rare. And plus it's not a very common thing people deal with, right?
Yeah.
It's a rare. What's the look up how many people have alopecia areata? What's the percentage of having? It's probably like 1% or less than 1%.
Yeah, that's what I was thinking, because I think I read that too. 1-2%, tiny.
It's bad luck.
Once in their lifetime. Yeah. It's weird that I would have it, because I've never had any issues at all.
Well, the good news is that if you're going to have a disease, it's a good thing it's a treatable one, right?
Yeah, it's not terminal. That's good.
Alopecia areata, hair loss, days to cure, years. It could take years. Sometimes it's uncurable. There's definitely been people that come in.
Oh, there you go. I can see that.
160 million people worldwide. So out of 7 billion people, 160 million. I think that's 0.01% maybe.
Yeah, that's much less than 1%. I was thinking.
700,000 people in the United States have 164 million. Did you
That's
play the
3%.
lottery after this?
What's that?
Did you play the lottery after your diagnosis?
No, I think I will now. I got lucky. Yeah, odds of developing were higher among Asian, really? Black and Hispanic?
Did you do a gene test? You might be 1% Asian.
Yeah, maybe that's it. My hair's not black enough. They have some serious hair. But it's good to know that if you have it, at least there's much more modern treatment these days. You can do something.
Yeah, for PRP, we've treated with PRP and then transplanted, but it doesn't always work.
Right.
The adipose, we treated a lot of skin, like scarring alopecias with adipose, were untreatable. Can't graft them. And not only did the hair some of the hair start coming back in, but we could actually transplant it.
Wow.
Yeah, so this new protocol is huge.
Are you marketing that to people that have issues?
Just started. Hopefully, we'll see if they find this video.
Yeah, I hope I can help you, because, boy, it's been an overwhelming success. Just look at my hair.
Well, we've been sitting on it for 6 months. We just, longer than that. We finished this up in, 2024? And you've been good. We started in 2023. You were back to normal in January. And now 2 years later, almost 3 years later, the condition has been put at bay. I could think we were just kind of wanting to see what would happen before we started publishing out and say, hey, this is a protocol that works.
Okay, yeah. Just looking at the pictures, you can see it all came back the way I wanted it. Yeah, now it's just doing those things that you talked about, the maintenance.
Yeah, we've got to do something with the crown.
Yeah, so I was going to come back in. So we'll do what we talked about, and then after that I'll do some more beard on the crown, and then continue the maintenance, and that should keep everything.
We got like a 30% drop in density. I think if we can turn it back on, you might not need to do something in the crown in terms of transplants.
Right, okay, so we'll do that.
Hopefully.
We'll do it in
because it'll match the density here and here if we get a 30% rebound.
Well, that'd be amazing. Mm-hmm. Wow. Yeah. So then you really have been able to activate the cells that kind of didn't die, but went dormant.
It's a diameter right now. So right now your hair's like this, and we need to turn it into something like that.
Which is the front. The front's got the.
Front's got the thickness. It's held on to the thickness. It's like equivalent thickness as your donor area. And the mid scalp, same thing. It's just right here we got a little bit of a drop in terms of it's not the hair count, but the diameter of the hair's down.
Okay.
So give us some growth factors. Fertilizers makes bigger fruit. That's what we got to do.
I like it. Yeah. Okay. I'm all for that. So that'll be the next procedure that we do. Mm-hmm. And then just going forward, continue to do that all around, because obviously age has an effect.
Yep.
You don't see too many old people with it.
It should start slowing down for you, though. the hair loss.
Right. They say some of those natural things help with the DAT as far as DHT blockers.
Saw palmetto is one of them.
Yeah, I've been putting that liquid on there too. The pumpkin.
Pumpkin seed oil.
Yeah.
Yep. Arginine. I don't know if it's for DHT. But you can do latanoprost, ionoprost, same thing.
Yeah. So I bought all that stuff. I mean, I think it all helps, but clearly it was good to do the injections to not only halt it.
Well, those everything you did is a Band-Aid. Of course, it helps. It definitely helps. It's just not it just doesn't give you the same results as some kind of a regenerative protocol.
Yep.
Whether it be adipose or any of the exosome cell-based therapies are much better than over-the-counter supplements, unfortunately.
I guess the key is to have done all that stuff a long time ago, but you never read that before. Maintenance, and to start early when you're young.
Mm-hmm. Well, everyone told you the transplants were permanent. You don't need to worry about it, and there's plenty of hair to move up here to fill it back in, and that's just not the case. The transplants thin out a little bit over time too, unfortunately.
Yeah.
So we got to do something to help you hold on to it, especially if it's really aggressive.
Yeah.
Yours wasn't terrible. I mean, it was always usually isolated to the front, but 10 years later, the crown's starting to go, unfortunately.
Yeah.
But you got plenty of beard.
Yeah, the crown's bugged me probably since I ever started coming in here, but you don't see it. It's the first impression, so it's important to start filling this in because I don't know if you remember, but this was just so thin up there.
Yeah, you shed a couple hairs out in the front.
Yeah.
Little strands, islands.
Yep, and then we started chasing the hairline, which is good because it's the last time your dad really straightened the hairline, which makes a huge difference to me. I get compliments on it all the time.
Yeah.
And now it's just maintaining it, and then like you said, filling in on the back so it all looks like I never lost anything.
Was it your high school friends or women you're chasing?
It's the women that chase it. They like to rub the fingers through it.
Oh, well, it's bushy.
I walked into this restaurant I go in all the time, and she said, "Your hair's really growing out. It looks good." I hadn't seen her for like 2 weeks. "Your hair's really good. Go good." I said, "Yeah. I'm trying." But most older guys just lose so much hair.
Yeah.
Don't want to let the old man in.
No. It takes the years off. It really frames the face. Like, you can honestly reverse it by 15, 20 years sometimes, just building a hairline. It's crazy.
Yep. You see it with AI. They're starting to do these. Well, when they do AI is famous people. I'm 80 years old, but before I was this, and then the guy takes it back. Have you ever seen that video? Mm-hmm. And it's AI, but it's so precise. You really think it's the actor, and you can see how the hair changes.
Yeah.
It's like, wow, what a difference.
Yeah, Stallone was talking about actually making a movie, the pre-Rambo, the prequel, like how he became Rambo. He was going to use all that AI to play himself in the movie. That'd be pretty cool, don't you think?
Yep. He's had some sort of procedure.
Oh, yeah. Oh, yeah.
He's got that bulletproof hairline. Looks like the hair doesn't move at all.
Well, he did. I know he did something. Hopefully he holds on to it.
Exactly, because he has some serious hair. Yeah, you can see in his earlier pictures how it had disappeared. Mm-hmm. But, I mean, why not if you got the donor area?
Yep.
And now to do those procedures that you have to maintain what you do move around, because like you said, it's not permanent or it thins.
Well, it's nice not to have to resort to a pharmaceutical. I know you're not a fan of pharmaceuticals, and it's just great to have the alternative that does work.
Yep.
Because unfortunately, rosemary oil just doesn't do the trick for most 99% of people. So, and it's not a constant headache. You don't have to constantly apply something to your scalp once a day. Oh, did I take that pill? No, you just come in, do your injection, and you're good for the year.
Yep.
It's
and
like
I like the idea about the banking it too. It's nice to be able to preserve all that.
Oh, that's gonna. If we do, when you come in to bank your stem cells, it's gonna have so many more benefits than just your hair. Yeah. You go IV with them, and if you have an illness, there's guys they'll have a common cold and they'll start snorting their stem cells through like one of those nasal bottles. Yeah. Clears it much quicker. Injecting your knees, your hips. My dad did his hip and his wrist.
I can see his wrist because of what he does.
Yeah, for high school. Well, it was high school football. He was blocking a tackle, and it's always bothered him. So he usually wears like a brace on it to keep it at bay.
Yeah.
And then, but he injected. He's like hopping on his bike, not wearing the thing, and he started the hip. He couldn't stand up to do. You know, when you're doing the mountain climb, you got to stand up. I think that was really irritating him.
Wow.
Injected that. He's like, I'm going back in next month. We're doing it again. I feel great.
So you just keep injecting it into the sore spots.
Yep.
which
Yep.
for most people
Knees.
are the knees.
Yep. Shoulders. There's guys that avoided shoulder surgery doing it.
Yeah, the golfers and the tennis people.
Yep.
That's amazing. So you bank it and you just keep doing it
Yep.
for as long as you're around. Wow.
People they're also used for like anti-aging. A lot of the actors.
They put it in the face?
Yep.
Oh my gosh.
I know one doctor in Greece. He's not using the stem cells, but he's injecting fat in the breast.
Yeah.
It's more like a natural. It doesn't look as artificial as the implants do.
Wow, that's amazing. But then you can keep using it for the hair.
Yep.
Which is
Oh,
what we'll
constantly.
do.
And it lasts a long period of time. Like most stuff will last about a year. This stuff you should get about 3 years out of it.
Yeah, you told me that. Good. Well, I'm sold. I was sold before. I should have done it before, but just did so many things and then all of this
So
stuff.
it's kind of a scare. And plus, we didn't give you a whole lot of confidence. Like, it might work. We hope it does,
But now you're more confident.
Yeah, we're very confident. We got living proof. And we keep seeing proof
Okay.
happen again and again. A lot of guys are doing the adipose these days. Like, I've been pushing it harder, and the results have been coming in with it consistently. And I've yet to see someone move backwards from doing an adipose. So
Right.
it's worth the investment, in my opinion.
Right. So now you can show what the adipose did, because that's what you did at the beginning, right?
Yep.
To stop the decline.
Yep.
All right, good. That should help you.
Yeah, I think so.
Help people too.
A lot of
Think
people.
There's no.
I'm thinking there's going to be a lot of alopecia areata people calling,
Well, they should, because it's just such a terrible thing.
It is.
And you read about it, and it's like, good luck.
Mm-hmm.
Is what you read online. I've heard-
Killer. Hopefully, it cures itself.
That's what you read. It's
Yeah.
like, well, I can't do this for a year. Hoping it's going to come back. I mean, they say it probably does, but just sit around.
People, it doesn't.
When we looked at that last picture by November, it was all cured.
Yeah, it was growing in. It was growing in. We just had to wait for it to elongate.
Yeah. And I've had little bouts of it because I can see the white hair, but I think if I come in and do what you're talking about, then that'll make a big difference on a regular basis, because I haven't been too regular.
I know. Got busy.
Got busy.
That's the hard part. People get busy.
Yeah.
When-
So you guys are the solution to any guy that has issues, for sure. You got it all covered.
Try to. Good deal, man.
He does. He does. He does. She does. She does.
Well, I
Well, I hope
appreciate you
it's-
doing the video with us.
Yeah, I hope it helps.
Yeah, I think it will. We'll cut it down. We'll make it look perfect.
Yeah. And then my case was so bad.
It was, yeah. It was
It
rough.
was bad. And it accelerated, which probably here in the summertime, I mean, it was gradually, all of a sudden, and that was 6 months after it started. So if I had come in when it started to hit,
Yep.
it would have really, you guys would have really stopped it.
Probably.
I didn't even think about that. So if I'd come in March instead of August, we didn't know.
Yeah, I think you called me, so I think, hey, Nick, my hair's falling out. Like, it's probably just a shed. They go through, we talked about the plateaus. You'll be stable for a while, then boom, you'll fall off the cliff and then stabilize again.
But
That's
it
what it was initially, and then started looking at it. You started getting really bad, like, oh, God. It was
yeah, yeah. But, I mean, everything's an investment, but still, most men don't realize that what you guys do, and I've told so many people, it's just so non-invasive. Because before, when I was up in New Jersey looking into it, the surgeons in New Jersey and New York, it was cut and do it the old-fashioned way. You have that scar, they kind of.
Oh, you're talking about strip, but not even,
Yeah.
if you were to compare, now everyone's doing FUE, but you shop around on that. I go to a grocery store and I'll be grabbing something off the shelf and I'll see someone's got his head shaved all the way down the sides, so partial shave,
Yeah.
and you just see these giant FUE dots. I'm like, oh God, that looks terrible. And the kid's
Yeah.
like 24 years old. It's like that's a turkey transplant right there. Broad, low hairline.
That's how they do it.
He's got nothing left here to take, and as you know, it's a continuous, ongoing problem. So the scarring looks a lot worse. You can see the signs that the FUE was done.
Terrible.
Whereas ours are like they're much tinier from the
Mhm.
tools.
Yeah.
And then managing the donor ear, not doing something that's going to set you up for failure, because they're literally putting hairlines down to here on their forehead.
God.
And if you're going to lose the whole top of the head, you're not going to have enough to finish everything. It's going to look silly. It's going to look silly if you just have
Sort of.
hair here and nothing behind it.
Wow, that's so turkey.
Yep. That's
Yeah.
well, in the United States, you've seen a lot of bad work too.
Yeah.
It's just a lot of cosmetic doctors that do rhinoplasties and things of that nature. They're coming there. These sales reps come to them and say, "Hey, we'll sell you this device, and all you got to do is sell your patient a transplant. We'll fly a team in to do it for you." Also, that's destroying donors, and that's giving people these silly looks. Grafts growing different angles. They think anyone can do it. Mickey Mouse procedure. And I talked to a lady 2 days ago that had that done in North Carolina.
Yeah.
And I told her it's going to cost you 15 grand at least just to remove it.
Oh my gosh.
And then we got to rebuild it. You're going to spend more than double what it costs to do it right the first time.
But you can fix something like that?
You can fix it.
That's
You
good.
can fix it.
That's another thing that's good, that you can fix it. But yeah. But it just makes you wonder why older men just don't do it if they have any kind of donor area, just to kind of fix all this on a more permanent basis.
They should. They should. It's huge because you think about it every day, don't you? You look at it, you're like, man, what's going on with my hair?
50.
Let me push it this way, put a little bit of spray on it so it holds.
50 times a day.
Yeah.
Yeah. That's the best thing. Well, I hope those referrals that I gave you, I talked to some of those people for you. I hope they came in and did it. They seem like, yeah. Gotta write a check. I said, get in there. It's non-invasive and you'll love it. Lovely people. But anyway, yeah, it's all a good procedure. It's just something you need to keep doing to maintain it. Which is,
Well, hopefully, it depends on the person, too.
right.
Some guys don't have aggressive. There's guys I don't see for 30 years.
Wow.
Yeah.
Yeah. You fix them one time and that's it.
For the most, I mean, these guys we tracked from like 1990, and they came back in for a touch-up session, but 30 years later.
Wow.
There's guys like that, and there's guys that got to go every year, and they got 5'10". These are one of the things we don't have a crystal ball. I've got guys that are completely bald up top, and we did a full restoration, and they held on to their hair. And then I got guys in the same category where 50% of the hair transplant fell out.
Really?
That's rare, but
Yeah.
it has happened. That's why we pound the table so hard on regenerative medicine.
Ah.
Because we don't want you to wind up being one of those guys, even though it's uncommon. Just the perspective because of the limited donor supply.
All right. So that's with the injecting the blood and the other stuff.
That's something new you didn't know about. You remember ACell?
Yeah.
We switched to a new provider it's called Regenerative, 6 times more concentrated.
Yeah.
Yeah, the results are going to be better. They're using ACell just use stuff from the kidney. This is stuff from the spleen, the lung, and the kidney.
Oh my god.
You ever seen smokers once they quit smoking for like 6 years?
Yeah.
Lungs will go from black tar to nice and pink, heals itself.
Oh wow.
You know, they extracted those growth factors, so we'll be able to regenerate more follicles.
Wow.
Yep. That's the closest we got to cloning. It's not full cloning, but follicle regeneration is huge.
All right. Well, you have to tell me about that next time after I do the other procedure.
Yeah, we'll put a little bit on your beard, see what we can regrow.
So something you put on?
Yeah, you after we do the extractions. So it's a stem cell comes in contact with the particles. It's like, hey, something's missing and think about like a salamander. You ever try to catch a salamander and the tail falls off?
Yeah.
New one will eventually start to grow back in.
Wow.
So similar concept. As long as we leave some particles behind, we don't cut torso in half. We leave a piece of the tail. It can regenerate itself.
Oh boy. Let's try that next time. All kinds of exciting things.
Yeah.
All right.
Cool.
Okay.
Well, I won't take up any more time. Thank you,
Good.
Brian.
My pleasure. Always a pleasure, especially to learn about all these new things.
ForHair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair. We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.